I'm Dr. Shalom from Department of Anatomy, AIMS Rajkot. I'll be covering embryology and morphology of the normal heart. The cardiovascular system is the first system to function in the embryo, and by the end of third week, we have the formation of the blood vessels, and by fourth week, there is formation of a single median cardiac tube. And as the week progresses, there is formation of the septum, chambers, and by the end of the seventh week, we have a four-chamber heart. So let's see the formation of heart tube. The endothelial tubes are developed in the cardiogenic area of the intraembryonic mesoderm. These are the two endothelial or endocardial tubes which later fuse from craniocaudally into a single tube. This tube presents certain dilatations. It has got an arterial end and it has got a venous end and a primitive ventricle and a primitive atrium. Let's see the arterial end first, that is the bulbous cordus. It has got three parts. The proximal one-third part, which gives rise to the trabeculated part of the right ventricle. The middle conus part, which will form the outflowing part of the left ventricle and the right ventricle. And the distal part is the truncus arteriosus, which will form your ascending aorta and pulmonary trunk. Then coming to the primitive ventricle, which will form the left ventricle, and the primitive atrium, which will form the right atrium and the left atrium, and then the sinus venosus, which I will explain later. Now this heart is forming in a limited space called as the pericardial cavity. It needs more space to grow. So it starts to bend. It bends at the first, it will bend at the bulboventricular sulcus, forming a U-shaped bend. First is an U-shaped bend. This is the first bend. And secondly, it will bend at the atrioventricular sulcus, forming a complete S-shaped heart tube. And finally, it will achieve the position that is the in the adult position. Also, we can see the right atrium, left atrium, and the superior vena cava, inferior vena cava. All will have it is related to the posterior side. We will see the sinus venosus in detail. Sinus venosus has got two main parts. That is the body of sinus venosus, which give rise to the smooth posterior part of the right atrium. Then we have right horn and the left horn. Each of the horns receive three set of the veins. That is the vitelline vein, umbilical vein, and common cardinal vein. Similarly on the left side. Now on the left side, all these veins degenerates and the left horn of the sinus venosus forms the coronary sinus of the heart. Whereas on the right side, the right vitelline vein forms part of the IVC, right umbilical vein completely degenerates, and the right common cardinal vein forms part of the SVC. And the right horn of the sinus venosus gets completely absorbed into the atrium, forming the sinoatrial orifice. This is the part of the truncus arteriosus where a spiral septum is formed, that is the aorticopulmonary septum, giving rise to the pulmonary trunk and the aorta. If there is failure of formation of this spiral septum, it can lead to an anomaly called as transposition of the great vessels, where aorta and pulmonary trunk will be parallel to each other. Let's see the formation of the atrioventricular canal. This is the primitive ventricle, this is the primitive atrium, and the ventral and the dorsal wall of this ventricle, there are certain swellings called as endocardial cushions, and these endocardial cushions try to approximate each other and gets fused in the middle. That area is known as a septum intermedium. Now, if you take a section on this plane, you will see this, that there is formation of the right and the left atrioventricular canal. Let's see the formation of atrial septum. Here we have the fused endocardial cushion or the septum intermedium, and there is a septum primum which comes from the roof of the atrium. It comes down. As it goes down, there is an opening here that is called as the ostium primum. Finally, the septum will come down and fuse with the endocardial cushion. So the blood from the right atrium, it has to pass to the left. So with the process of apoptosis, the part of the upper part of the septum primum degenerates and there is a formation of opening called as ostium secundum. At the same time, there is another septum which comes down from the roof that is called as a septum secundum, the one shown in blue. It comes on the right side of the septum primum. It grows all the way down up to the tip of this septum primum. And the blood flows from the right to the left through this opening, that is the foramen ovale. Now, after birth, the pressure of the left atrium is much higher than the pressure of the right atrium. So, the septum primum will close like a valve and there is complete formation of this septum. And this will be the depressed area over here. That will be the fossa ovalis in the adult heart, human heart. So any anomalies in the closure of this septum will lead to the atrioseptal defects such as the ostium primum defect, ostium secundum defect, patent foramen ovale. Formation of the ventricular septum. The ventricular septum has got two parts, that is membranous part and a muscular part. So the muscular part is formed by the proliferation of the cells, that is the interventricular septum, from the floor of this primitive ventricle. Now the membranous part, it is formed by the right and the left bulbar ridges as well as the endocardial cushions. So there is proliferation of this right and left bulbar ridges and endocardial cushions. Once it gets fused here, that forms the membranous part of the ventricular septum. To conclude, the endothelial heart tubes first appear in the cardiogenic area in the intraembryonic mesoderm. And we have formation of a single heart tube. This is the arterial end and this is the venous end. And then by the end of the 7th week, we'll have a complete 4-chamber heart. So knowing this basic embryology can help in better understanding of the congenital anomalies. Thank you.
External features of the heart presents the apex. It is formed by the left ventricle and it lies at the level of 5th intercostal space medial to mid-clavicular line. And base of the heart is the posterior surface. It is formed by the two atrium, mainly by the left atrium. Clinically, the base is the upper border of the heart where the great blood vessels are attached. Now we will see the surfaces of the heart. It has got a sternocostal surface or an anterior surface. It is mainly formed by the right atrium, right ventricle and the anterior part of the atrioventricular groove and partly formed by the left ventricle as well as the left auricle. The left atrium is usually hidden on the front by the ascending aorta and the pulmonary trunk. Now, the diaphragmatic surface is a flat surface. It rests on the central tendon of the diaphragm and it is formed mainly by the right ventricle and the left ventricle. Now, the left surface of the heart, it is formed mainly by the left ventricle, partly by the left atrium and left auricle. Now we will see the borders of the heart. It has got a right border. The right border is formed by the right atrium. It extends from the opening of SVC to that of IVC. This is the right border of the heart. Inferior border of the heart extends from opening of IVC to the apex. It is a horizontal border, and near its apex it presents a notch called incisura apicis cordis. Now, the upper border of the heart is usually obscured from the view because of the ascending aorta and the pulmonary trunk. We will see the chambers of the heart. This is the right atrium, right ventricle, left ventricle, and the left atrium. The chambers are demarcated by two sulci, that is the coronary sulci and anterior and posterior interventricular sulci. We will see the coronary sulcus. This is the coronary sulcus. It encircles the heart and it is deficient anteriorly due to the root of the pulmonary trunk. The anterior part of the coronary sulcus, on the right side, it lodges the right coronary artery. Similarly, on the left side, it lodges the left coronary artery. And the posterior part of the coronary sulcus, this is the posterior part of the coronary sulcus, it lodges the coronary sinus. Next, we will see the anterior interventricular sulci. This is the anterior interventricular sulci. It lodges the anterior interventricular artery and the great cardiac vein. The posterior interventricular sulci, this is the posterior interventricular sulci. It is seen on the diaphragmatic surface. It lodges the middle cardiac vein and the posterior interventricular artery. The meeting point of the interatrial groove and the posterior interventricular groove and the posterior part of the atrioventricular groove, that is the coronary sulcus, it forms the crux of the heart. The crux of the heart is an important anatomical structure where blood vessels like atrial, ventricular nodal artery, posterior descending artery and conduction bundles are seen. We will see the chambers in detail. This is the right atrium. So as you can see, this right atrium consists of a cavity and a small outpouching called as the auricle. The right atrium, it receives superior vena cava and the inferior vena cava. The upper anterior part is prolonged to the left to form a right auricular appendage called as the right auricle. A shallow vertical groove which extends from the superior vena cava to the inferior vena cava along the right border, it is called as the sulcus terminalis. The upper part of the sulcus terminalis consists of the sinoatrial node. Now we will see the internal features. The internal features, it is divided into two parts, mainly the smooth posterior part, which is called as a sinus venerum, and a rough anterior part called as the atrium proper. Now the two parts are separated each other by crista terminalis. The crista terminalis corresponds to the sulcus terminalis exteriorly. This smooth posterior part, called as a sinus venerum, it is derived from the right horn of the sinus venosus. All the venous channels except the anterior cardiac veins opens into this part. That is the superior vena cava, inferior vena cava, as well as the coronary sinus. This is the opening of the coronary sinus. Now the rough part, it is derived from the primitive atrium. It presents series of transverse ridges, the muscula pectinati, which arises from this crista terminalis. The sponge-like interior of the right auricle prevents the free flow of blood and thus favors the formation of thrombus. The thrombi may dislodge during auricular fibrillation and may cause pulmonary embolism. Now we will see certain openings in the right atrium. So this is the opening of the superior vena cava. It returns the blood to the heart from upper half of the body. This is the opening of the IVC. It opens at the lower end of the right atrium. It is guarded by a valve known as Eustachian valve or the valve of inferior vena cava. Now we will see the opening of the coronary sinus. This is the opening of the coronary sinus. It is guarded by a rudimentary non-functioning valve called as Thebesian valve. Then we can see the right atrioventricular orifice. This is the largest opening. It communicates with the right ventricle. It is guarded by the tricuspid valve. And also there are many other small orifices of small vein, openings of small veins. They are the openings of vena cordis minime and anterior cardiac veins. Now this is the septal wall of the right atrium. It is developmentally derived from the septum primum and septum secundum. There are certain features in the septal area. That is, this is the fossa ovalis. This fossa ovalis is a shallow oval saucer-shaped depression in the lower part. It is formed by the septum primum. It represents the site of foramen ovale in the fetus. In 25% of the subjects, a valvular opening may be found extending upwards and to the left from the upper part of the fossa ovalis, and it communicates with the left atrium. It is known as propatency of foramen ovale. It signifies that anatomically the foramen ovale remains open, although physiologically it is closed. Now we will see the annulus ovalis or limbus fossa ovalis. It represents the free edge of the septum secundum. It forms the distinct upper and the lateral margin of the fossa ovalis. Inferiorly, the annulus ovalis, it is continuous with the left end of the valve of IVC. We will now see the triangle of Koch. It is a triangular area bounded by, in front by the base of the septal leaflet and behind by the anterior margin of the opening of the coronary sinus and above by a subendocardial ridge, that is a tendon of Todaro. In this triangular area, the presence of AV node is seen. Next, we will see torus aorticus. Torus aorticus is an elevation in the anterosuperior part of the septum produced due to bulging of the right posterior, that is a non-coronary sinus of ascending aorta. We will see the right ventricle. This is the right ventricle. Now this is the interior of the right ventricle. It consists of two parts, a large lower rough inflowing part and an upper small outflowing part called as the infundibulum. The two parts are separated by a ridge, muscular ridge called as the supraventricular crest or the infundibuloventricular crest. The inflowing lower part, it develops from the primitive ventricle. It is rough due to the presence of the muscular ridges called as the trabeculae carneae. It forms most of the right ventricular chamber. The outflowing part, it develops from the bulbus cordis. It lies above the supraventricular crest. It is smooth and forms the upper 1-inch conical part of the right ventricular chamber, that is the infundibulum, which gives rise to the pulmonary trunk. These are the trabeculae carneae. Right ventricle has got 3 papillary muscles, that is the anterior, posterior and septal. Here we can see the anterior papillary muscle. From the apex of the papillary muscle, you can see the caudate tendinae going to the tricuspid valve. We can also see the moderator band. It is a thick muscular ridge extending from the ventricular septum to the base of this anterior papillary muscle. It conveys the right branch of the atrioventricular bundle or the bundle of His. Now we will see the left atrium. This is the left atrium, quadrangular chamber situated just left to the right atrium. Behind the left atrium, we have the oblique sinus of the serous pericardium and fibrous pericardium, which separates it from the esophagus. The internal features: the left atrium is smooth and the auricle, this is the left auricle. The left auricle possesses muscular ridges in the form of reticulum. And the openings of the left atrium, there are openings of 4 pulmonary veins. They do not have any valves and they have number of small openings for the venous chordae minime and another main opening, that is the atrioventricular orifice, which is guarded by the mitral valve. This is the mitral valve. Now we will see the valves of the heart. There are 2 main types, that is atrioventricular valves and semilunar valves. The atrioventricular valves on the right side, that is the tricuspid valve. The tricuspid valve, as the name suggests, 3 cusps are there. This is the anterior cusp, this is the septal cusp and this is the posterior cusp. Tricuspid, that is, it can admit at least 3 fingers. Similarly, on the left side, the left atrioventricular valve or the bicuspid valve or the mitral valve, it has got only 2 cusps. This is a large anterior cusp and a smaller posterior cusp. And caudate tendinae of each papillary muscle are attached to the contiguous halves of this 2 cusps. Now we will see the semilunar valves. Semilunar valves consist of the aortic valves as well as the pulmonary valves. Now I will show the aortic valve. It has got 3 cusps. This is the anterior cusp and this is the right posterior cusp and this is the left posterior cusp. Opposite to the cusp, the root of the pulmonary trunk and ascending aorta present 3 dilatation called as the sinuses, and the anterior aortic sinus gives origin to the right coronary artery. Similarly, the left coronary sinus gives origin to the left coronary artery, and this is the right posterior aortic sinus, which is called as a non-coronary sinus. Now we will see the pulmonary valve. This is a pulmonary trunk. It has got 3 cusps. This is the right anterior. This is the left anterior. And this is the posterior cusp.